heart health. We all know it's important, but what steps are we really taking to keep things pumping the way they should? Here at HeartFit Clinic, they emphasize proactivity and offer personalized treatment programs should a problem arise. Let's check the pulse of what's trending at HeartFit. Diamond, what did you set out to do now more than 15 years ago with HeartFit Clinic?
I think the big focus is we bridge a gap in the healthcare system. We're here to work collaboratively with your healthcare professionals so that we can truly help people prevent or even reverse that disease process.
You've always had a different approach, a different idea on how to treat this, haven't you?
I think I really wanted to empower people to understand that these arteries are a muscle, not a pipe. It was always taught to me that these arteries are a plumbing problem, and it's not the case. How artery disease happens is that the majority of people who have heart attacks, heart disease, actually have normal cholesterol profiles. And the common misconception is that cholesterol accumulates to this pipe, and you have a last cheeseburger and fries, and you end up with a heart attack. And it doesn't happen that way. Cholesterol doesn't accumulate to a pipe. It builds up inside the lining of the artery wall and builds up just like a pimple would on your face. And if that pimple pops, that is a heart attack. And that's why if you go to a cardiologist, they're looking for advanced stages of disease. They're looking for the plumbing problem. And 90% of heart attacks get missed when you're looking at it that way.
If I come to you for an assessment for HeartFit Clinic, what do you do?
And it's sort of like putting a puzzle together, really. We do a number of assessments and we piece them together to really understand where that risk is for that individual. But what we're really doing is personalizing our approach to the patient so we can take all that information, and what your assessment looks like is going to be different from what my assessment looks like. Some people may come here looking to be solely preventative, proactive. Others may have already had heart disease and they really want to look at sort of treating and potentially even reversing disease.
Heart disease likes to progress, and at the HeartFit Clinic, we like to regress it. We like to reverse that disease process by diving deeper.
Diamond, what are some of the things you do to determine where you're at on the treatment scale?
I talked earlier about how the majority of people who have heart attacks and strokes have normal cholesterol profiles. And the reason why is because doctors look at cholesterol like a bucket, and inside that bucket is different sized balls. We'll call them golf balls and tennis balls. With the healthcare system, they just care about what the size of that bucket is. Is it too high or is it too low? At the HeartFit Clinic, we like to turn that bucket upside down and separate those ones. Why? Because those smaller particles are vulnerable for slithering into the lining of the artery wall. Imagine the artery protected by a tennis net-like structure. Tennis balls don't go through, golf balls do. And we're the only clinic that has testing to see where your risk is of that heart attack or stroke. Alfred, how are you feeling?
Just fine, thanks.
Excellent. What made you decide to come to the HeartFit Clinic?
Well, this treatment is unique, and to my knowledge, I couldn't get it anywhere else. So that's why I'm quite happy to be here and get treated.
I know you've been ahead of the curve from the get-go on this. What is the latest research showing, though, in what you're doing in your approach?
So the trials that have come out now have supported a lot more what we do in terms of integrative cardiology testing and rehab, with understanding where individual deficiencies are with people's blood work, getting into the treatment side of things with external counterpulsation where we can grow new arteries, and improving heart function. So people who have heart failure or poor circulation, we can truly make a change to someone's artery health.
What's the best part of your job that makes your heart full?
You know, it's people coming in here saying, I want to make a change. And I love that. I love being able to help people that want to help themselves, because we can work with them. We can really, get to the goals that they have, whether it's being there for their grandchildren or going on that next vacation or playing hockey. It's really getting to know our patients, and that's what I love about it.
What about you?
When you see the impact that we've made on their health, that's priceless.
To learn more, head to heartfit.ca.